How diabetic health equals wealth, guys. Things you should know. As a diabetic, never underestimate the power of regular health and wealth checkup, guys, or checkups. So, as the ancient Greek physician Herophilus wisely noted, when health is absent, wealth becomes useless. Embrace this timeless wisdom and prioritize both aspects of your well-being today. Your future self will thank you guys for it, especially if you're a diabetic. So in our daily discussions with friends and family, have you guys even noticed that when we have a conversation, it all comes down to talking about money? When one form or the other, it's usually talking about your job, talking about you can't pay your bills, or talking about I'm making a ton of money and I'm doing well. It always comes down to that, right? So how to make more, how to safeguard your wealth and all that good stuff that you have saved over the years. It's always about that type of discussion. However, I believe that if health isn't part of the equation as a diabetic, there's limited value in accumulating or amassing any wealth because you can't enjoy it, right? So after all, it's for the benefit of you and your loved ones, isn't it? So today I'm going to go off the beaten path. Instead of talking strictly diabetes, I'm going to talk about diabetes, health, and well-being, and not any particular food today, but more of a mindset so you can understand that without your health as a diabetic, you have nothing. So let's get into it, guys. An impressive 80% of our health is shaped by social determinants, as per the Office of Disease Prevention and Health Promotion in Canada. These factors encompass our financial statuses, senses of control over our lives, and self-care practices. But it's clear that our income level, influence, and self-nurturing behaviors significantly impact our health, well-being, and overall quality of life as a diabetic. So, checking up on your health and wealth is a smart move, right? If you don't know, my name is Mr. A1C, although I do have a medical background. This is not a medical channel. This channel shares my diabetic journey and how I was able to reverse my type 2 diabetes diagnosis using common sense with a little bit of trial and error over the years. So you don't have to, and I'm sharing that information with you today so you can hopefully reverse your diabetes diagnosis as well. So let's get into it, guys, again. So here's a simple 3-step plan. First, get an annual checkup by the pros. So when I say an annual checkup, you should get a health checkup like you always do as diabetic. You're always getting health checkups. But do you get wealth checkups? That's important as well, because without health, there is no wealth. So that's what I'm talking about. Second, find the right expert to guide you. So your doctor is your expert to guide you through your metabolic syndrome or your diabetes or any health issues that you're having. Find a financial analyst that knows what they're doing that can help you as well, a financial advisor. So third, and this is super important, guys, act on their advice. I know we often read things, we talk about things, but action is the key here. Talking doesn't get you anywhere. Talk is cheap, right? You talk the talk, you gotta walk the walk. So it's all about making the most of what you've got, guys, as a diabetic. So it's been often observed that a person's financial situation can greatly influence their health. Folks with lower incomes may report poorer health and face higher risk for chronic conditions such as diabetes and metabolic syndrome, like we always talk about in the videos, guys. On the flip side, there are those that are financially well off, but might be overworking themselves, neglecting their health as well. So as you guys can see, this health and prosperity, or health and wealth, go hand in hand. Without one, there's not the other. High stress levels, be it from money worries or work pressure, can trigger your body's main stress hormone, cortisol. So now you guys see how this is all tying in? Cortisol. Everybody knows what cortisol is, right? The catch is when our stress response system is consistently activated, the cortisol is consistently activated over a period of time, we're exposed to too much cortisol, which can lead to issues like high blood pressure, high cholesterol, and diabetes. What do we call that, guys? Metabolic syndrome. So now you're seeing how this all ties in. We're off the beaten path today, but we're tying it all in so you understand overall, holistically, how this makes sense. So the key for us diabetics is to work smart on our jobs. Work smarter, not harder. Work smart on our jobs, health, and finances, guys. Not just your health, your finances as well. Overdoing it with cortisol can lead to a not so healthy mix of health problems, of course, like diabetes and metabolic syndrome, as I discussed a minute ago, to say the least. All right, you got other issues that come with it as well. So in a 2015 study by researchers at the Urban Institute and Virginia Commonwealth University found that health and income are closely linked. The gist here is if you're healthier, you live longer and you're likely to earn more. This pattern holds true across different income levels, of course, right? So the wealthiest tend to have fewer health issues than the upper middle class, who are healthier than the lower middle class, and so on. It's a domino effect. So the report dug deep into health problems, checking them against household incomes as reported by the CDC in the USA. So what's the general trend? The wealthier folks were usually healthier. I know you guys are going to say, yeah, that makes sense because healthy food is more expensive now. Okay, we'll talk about that. So embrace the healthier lifestyle by following these fundamental steps, many of which you probably already know, guys, as a diabetic. Feed your body nutritious foods. Reduce or eliminate sugar. Stay active. Steer clear of smoking and illegal drugs. Moderate your alcohol. We always talk about moderation when it comes to diabetes. Ensure you get enough sleep. That's another key factor. You don't want this high fasting blood sugar in the morning when you get up. So get enough sleep. Get your 7-8 hours, whatever it takes for you to, have a healthy sleep that night. And dodge stressful situations whenever possible. Your health will thank you guys for it. I'm living proof that that's possible. So in 2019, research by Blue Cross Blue Shield indicated a notable correlation between millennials now, guys, their generational health and their economic prosperity. They're going to be the unhealthiest of all the generations. I'm Generation X, and above me is the boomers and below are the millennials. And then Generation Z, of course. So revealing a quicker deterioration of the physical and mental well-being compared to the preceding generations, like us. So the insightful Blue Cross Blue Shield study underscores the significant consequences of millennials' worsening health. So this is what we, as the previous generations, have to look forward to, the millennials having worse health. Well, how does that affect us overall as a population? That's a very negative thing, right? So, and I know most of you that watch my videos are, the boomer generation and things like that. But you got to think about these other people as well, the millennials and Generation X. They're going to have a lot of problems, and that's going to affect our lives as well. So guess who pays into Social Security? They pay into Social Security so we can benefit. Not me, I'm not there yet, but I will be. So we'll see a huge flux of diabetes and metabolic syndrome in the coming years in this generation, folks, predicting that it will hinder their full economic potential, just like we talked about. To reverse this trend, we must prioritize preventative care and wellness, focusing on the essential elements of a healthy lifestyle, balanced nutrition, regular exercise, and adequate sleep. And you know what this is all about, right? As generations move on, the food gets worse. It becomes more and more processed, and that's why we're seeing this. I mean, the boomer generation and the ones before them were much healthier than us. Because they ate less processed food. You didn't have all this crazy stuff, all these chemicals and dyes in the food. And, all this, who knows what they're trying to do to, the populations with the food, but that's what you're seeing. So simultaneously, shoring up financial health becomes crucial to enhancing economic stability, ensuring a brighter future for this generation. Millennials aren't only the ones who need to think about lifestyle factors, guys. Boomers. Most of you guys that watch my videos are boomers, the baby boomer generation, right? But boomer women often live longer than their male counterparts. So planning for the future becomes super important for their well-being. Financial anxiety can really take a toll on mental health, of course, guys. It's clear that a diet rich in vegetables and low in fat contributes to preventative health care. It's about time we apply the same thinking to our financial health as well, guys. No health, no wealth. No wealth, no health. They work together. They're synergistic. Instead of just asking, how do I prevent a heart attack? Let's also ask, how do I prevent a crisis by not considering retirement at 50? Right? Or 60, or 65, or 62, or whenever you want to retire. When it comes to financial planning, things can get a bit more complicated because everyone's situation is always unique. But don't worry, there are still some key foundations that apply to everyone. Savings are a crucial part of any solid financial plan for a diabetic. When you build a savings cushion, you're ready to cover those unexpected costs without piling up credit card debt, borrowing from family or friends, or adding to other loans that can cause unnecessary stress, of course. Setting up and safeguarding your retirement income is essential. The earlier you start, the better, guys. With global life expectancy rising, it's important to save enough for a longer retirement. Plus, future governmental and company pension support may not be as reliable as it was in the past. As you guys already see that, right? UPS, FedEx, all of these big companies had the best pensions and retirement. Not anymore. They don't care about their employees anymore. So keep that in mind. You have to take care of yourself first, especially as a diabetic. And let's not forget the growing health and social care needs to consider as well. It's a good idea to invest in some of your savings so inflation doesn't eat away at your purchasing power over time. So that means, yes, you got to have savings, but with inflation, savings is not doing anything. For every dollar you put in there, it's going to be worth less. So start investing the savings and diversify. Put it in different places so your money is working for you. You're not working for your money. So tax efficiency also matters, guys. So take advantage of valid options, reliefs, and programs that are available in your country for whatever tax programs you have to pay into. Lastly, don't forget about insurance. Life and critical illness policies, especially for us diabetics and people with metabolic syndrome, can help protect what you value most for yourself and your loved ones. So if you're finding value in my channel and videos, please subscribe to the channel, comment on the video, and share it with someone that needs the help with their blood sugar, guys. Don't forget to participate in the community area on my channel here on YouTube. We can get to know each other on the channel as well if you participate there in the community section. So here's a twist. Have you even thought about this? Have you considered that having your health automatically makes you wealthy or rich? I have. Think about that. Let's just take money out of the scenario completely. Having your health automatically makes you wealthy. Sometimes it's not always about the money, guys. Some people have all the money in the world and they're not happy, and that can lead to health, both health, physical, and mental issues. I bet you know someone in that situation. Well, I do. I apologize. That's my cat. He always tries to crash my videos. So it's not only about the money, guys. Money is just a tool to help you live a stress-free and healthier lifestyle as a diabetic. Health and wealth, they're super connected. You know it's key to cook up plans or come up with an idea so you can manage both, so you can savor all the sweet perks and chances life throws your way as a diabetic. And we love our sweet perks. I can't speak about you, but I love my sweet perks. In my channel, I say yes to desserts, and I have whatever desserts I want to have, and I've been able to control my A1C and my blood sugar. So yes, and as we get older, every boomer I know loves sweets. So guys, that's all I got for you today. I hope it was valuable to you. It was off the beaten path. It's not something I talk about all the time, but I think health and wellness as a diabetic is important to discuss as well. Not only the foods or the system that I use to lower my blood sugar, but it's the, the emotional, the mental, other parts, the other aspects of being a diabetic that no one ever talks about. So I thought I'd kind of hone in on that a little bit today and talk about the money factor and the wealth factor. Just the wealth, throw the money away and just think about health equals wealth. Without health, there is no wealth. Have a good day, guys. See you on the next one.